My family office was set up in 2005 in Lausanne, Switzerland. Do we have any Swiss here? I'm not a Swiss either, so I'm an Aussie. So I'm also a volunteer with Mercy Ships. I'm on the board of Mercy Ships, but we set up a foundation back in 2006. We put about 1.3 billion Swiss francs into it, and that was to try and achieve SDG 3. Through the process, and also on the call that I had in 2020 with FOSD, we found that the issues like SDG 3 is connected to SDG 2 and SDG 1. So all these things are interlinked. You've got hunger linked with food insecurity, linked with agriculture, linked with land use and tribal fighting, linked with education, human capital, economic development, and of course healthcare, which was our big kind of push. We were doing, I think we've done 93, my PA told me, 93 sustainable healthcare projects now in 47 countries. So our model is not to be like an impact fund and take funds out, or catalytic funding where slowly over time you take funds out of the project, but we just leave it there so that it becomes sustainable. And as Sergio said, I wrote it down here. I'll never forget your speech, Sergio. It was really good. Philanthropy creates economic development. That's really good, isn't it? I love that. Philanthropy creates. Anyway, so I guess we started with FOSD during that time, and we looked and we thought, well, I've got to have a briefing with one of the UN resident coordinators. So that's what happened. It's quite scary, all the issues they were having around the world. And so we thought we would kind of choose to help. The issues were way too big, though. Our family office had expertise just in this one healthcare area, but how could we help? So the only way we looked at it was to collaborate. So we looked and said, who can we collaborate with? And so how can we get medical supplies? How can we, developing countries at this time were building up supplies of vaccines and PPE and medical, other medical supplies, and developing nations had healthcare workers with none. And sea times and getting freight there was really difficult. But and I was working with Papua New Guinea at the time, and there were three healthcare workers in one of the hospitals died before I could get supplies there. And that will always stay with me. So we started, when you see things with your own eyes, you can't unsee them, The same in Africa, we do projects there. But anyway, so we partnered with FOSD, and they gave us all the high-level contacts, which was brilliant. We also partnered with colleague family offices as well. Then we reached out to corporates that had way too much stock, governments that had too much stock of medical supplies, and whatever else we couldn't get free, we purchased. And then we reached out to Maersk and DHL, and were able to fly stock in, just small amounts in to keep healthcare workers safe. And then we started to send larger sea containers. In fact, we've sent some of the SIDS that were here today as well. And so that was great. We started to get all that stuff in by air and sea, and patients were treated, healthcare workers were kept safe, and but the issue is not finished yet. The healthcare systems in the SIDS and developing nations is very, very fragile still, and it's not their fault. They're not retreating, it's just fragile. So they just need help and strengthening. And so that's what we're doing. We're kind of working now with FOSD to try and work on a bit of a think tank and an approach, if you like, to put in sustainable supply systems for them. Because you imagine what's happened, the US aid has retreated as well. So those supplies are gone. There's 600 million US dollars pulled out of that. They weren't the only ones to retreat. The UK and quite a number of other governments retreated at the same time, quietly though. So we're in there trying to help trying to get it going. So what else will they say? I guess one of the reasons we're in healthcare is because, I don't know if anyone reads the Lancet report. Does anyone read that? It's good to read on a plane or something. 5 billion people on the planet at the moment can't access healthcare. 5 billion can't access safe surgery. Can you believe that? And as a result of that, nearly 19 million people die every year. It's phenomenal. So that's one of the reasons why my family is working in healthcare. And we've just started, over the last couple of years, working with SDG 2, the hunger. We're working on regenerative agricultural projects as well. We got them in Africa and the SIDS. And we hope to get more of those happening as well, because it's very much linked to healthcare as well. Health and nutrition, agriculture, land use, climate, all very much interlinked. So yeah, that's about me. Sorry, I'm just a family office. I'm not a doctor or anything special. So thanks, everyone.